Good morning. Welcome to the Ready? Begin. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. Thank you very much. Clerk, will you please read the public participation instructions?
In order to protect public health and the safety of our Tuolumne County citizens, this Board of Supervisors meeting will be physically closed to the public. During the board meeting, citizens who wish to comment should be prepared to use our call-in line at 209-533-6581 to queue for verbal public comment. Public comment will be open and closed individually for each agenda item listed below. If you wish to comment on a specific item, please call in when the board clerk has read the item. The chair will ask if there are any comments from the public at that time. Your call will be taken in the order it is received. The public comment time limit on each item is set for 3 minutes per speaker. The time limit does not apply to staff. Options for public access audio and video live streaming. The public will not have access for public comments through these media. These are available for audio and visual only. 1, you can view it on the Tuolumne County website, www.tuolumnecounty.ca.gov/745/board-meetings. 2, on Access Tuolumne by going to accesstuolumne.org and clicking Watch Live, or via Zoom webinar on your computer using webinar ID 987-3738-5155, or you can call in at 1-669-900-9128 using webinar ID 987-3738-5155. Please note that Zoom webinar services tend to have a reduced broadcasting delay in comparison to the county and Access Tuolumne live streams, and is suggested for the closest to real-time viewing and listening. You may also, important public notice, under the Governor's Executive Order N2520, this meeting will allow members of the Board of Supervisors to participate by teleconference, and under Order N2920, accessibility requirements. If you need swift special assistance during the board meeting, please call 209-533-6581.
Thank you very much for that, Clerk. Do we have any comments from the public? Okay, we have 2 folks on the phone. Will you please let the first person in line go?
Hello?
Hi, you're on with the board. Go ahead.
Okay. Hi, good morning, Vice Chair Campbell and members of the board. Thank you for giving me this opportunity to speak with you today. My name is Julie. I'm a wife and mother. I have 2 wonderful girls, and my husband is making machines to help speed up COVID testing. I am also one of the leaders of Tuolumne County Indivisible. In a recent campaign ad, Supervisor Rodefer spent a large amount of time speaking about my group. He cited an anonymous fake website that is full of misinformation and fear-mongering. Supervisor Rodefer did not reach out to me or any other members of TCI to fact-check the information before speaking about it. I feel it is wrong for a sitting supervisor to attack our First Amendment right of freedom of speech, especially without asking a single member if the information was true. Supervisors, allow me to explain what my group does. Tuolumne County Indivisible fosters an inclusive environment where everyone is welcome. We hold candlelight vigils for many different occasions. The most recent was for Justice Ginsburg. We have run the Women's March since 2017 and continue to see more people come year. We have and will continue to work with Center for a Nonviolent Community as we fully support their amazing resources they provide to the county. Tuolumne County Indivisible also holds Rock the Vote events where we register people to vote regardless of party because we have the best democracy when everyone gets to vote. Our members donate to local charities and volunteer their time to help Tuolumne County be the best that it can be. This fall, Tuolumne County Indivisible will hold toy and food drives to help our fellow community members have a good holiday during a very hard year. Tuolumne County Indivisible has worked closely with the Sonora Police Department and Sheriff's Office many times, and we greatly appreciate them. In closing, Jessica, another leader of TCI, and I would like to extend an invitation to you, Supervisor Rodeford, and any other board members to sit down and have coffee with us so we can answer any questions you may have. Once we've answered your questions, you will see that we only want the betterment for our beloved county. Thank you for your time.
All right, thank you very much. I think we have one more person on the line who has a comment to make. Okay, you're on with the board. Go ahead.
Yeah, thank you. I'm concerned a little bit in regard to, can you hear me okay?
Yeah, we can hear you.
Okay, great. I'm a little concerned in terms of the community development department that the building permits are taking a long time to get resolved and approved, and it's giving contractors a real problem in terms of actually doing some of their building. And this is related to the fact that the budget has been cut so badly in terms of the development department. It doesn't affect me directly, but it does affect me in this regard. I'm concerned that the tot tax may not be passed again this next election. And I think some of that is especially poignant in terms of the fact that people don't trust some of the Board of Supervisors to make good decisions regarding finances. So I would like to ask that John and Carl and Sherry, assuming they're either going to quit or lose this next election, that upon finding the results of the election, that they'll abdicate and let the new people take over so that if they can make this pledge now, it may give the tot tax a better opportunity to pass. And I think that this is particularly directed at the three supervisors that are either up for election or who are not going to run again, because part of the reason why we don't need you guys making the decisions is because you made so many bad ones in the past. And I think especially for you, Carl, you only lost by 1%. Had it gone 1% more the other way, then we would have been done with this. So if you guys could make that pledge, I think it'd give the tot tax a much better opportunity to pass. Thank you very much. Actually poignant in terms of the fact that people don't trust some.
Has he done? Okay. All right, thank you very much for that. Are there any other comments or folks waiting to speak? Okay, no more left. All right, so thank you for that. So, Clerk, would you please read the consent calendar?
Did you do staff?
Oh, okay. Of course. So right now we'll go to any staff comment.
Thank you. Duh. It's election time.
You were sitting front and center. And
Yes, it's election time. Ballots were mailed yesterday and today. We actually had 9 voters come into our office yesterday and vote. So they all did their homework, I hope. So we're off to a great start, and that seems to be statewide. We have a lot of voters coming in early and starting to vote. Some of the larger counties had lots more, put a couple digits after my 9. I just want to remind everybody that their ballots should be in the mail. They should get them in the next couple days. Do your homework. If you're uncomfortable using the post office, we now have 8 different drop-off boxes. One can drop off their ballots. In your ballot pamphlet, there will be the locations of those. We've added 4 more. The vote centers will start opening up on October 31st, which is a Saturday. They'll be open from 8:30 to 4:30. My office, as you could tell because people came in yesterday and hopefully people will come in today, is open from 8 o'clock to 5 o'clock, and one can vote downstairs. Please do your homework. Remember, as some of the people who have talked, the local elections are really important. If you want to help pick the people that reflect your values, vote locally, as well as voting for the federal and state elections. Thank you.
Thank you.
Good morning. I'm Christina Herrera with the Public Health Department. I would like to provide a report on our upcoming drive-through flu clinics. We have 2 clinics coming up. One is on Wednesday, it's actually tomorrow, October 7th at the Groveland Library from noon to 4. The next one will be next week on Tuesday, October 13th from 9 a.m. to 3 p.m. at the Sonora Library and Senior Center area. Just a few reminders for the public planning to attend the drive-through flu shots. Have your registration form filled out when you arrive. The form is available on our public health website for download. We will also have copies at each event. Wear loose-fitting clothing such as a short-sleeve shirt. That way we can facilitate getting your vaccination a little bit faster while you're in the car. Stay home if you're feeling sick, and please wear an appropriate face covering when you drive up to get your flu shot. Shots are also available for children ages 2 and up while supplies last. The parent or legal guardian must be with the child at the time of vaccination. It's important to get your annual flu shot, especially this year. If you're unable to attend our drive-through events, free flu shots will be offered at the health department on Tuesdays from 8:30 to 11:30 a.m. by walk-in. I have flyers with me, and I'll also leave them in the back. Thank you.
Thank you very much for that. All right, any more staff reports? Okay, seeing none. Clerk, would you please read the consent calendar?
Approving the minutes of the September 15, 2020 and September 22, 2020 meetings. Number 2, approving the conflict of interest codes for the following Tuolumne County departments: Agricultural Commissioner, Assessor Recorder, Clerk of the Board of Supervisors, County Administrator's Office, District Attorney, Health and Human Services Agency, Sheriff's Office, Treasurer Tax Collector, and Weights and Measures. Number 3, approving the conflict of interest codes for Jamestown Sanitary District, Sonora Union High School District, Soulsbyville School, Tuolumne Parks and Recreation, Tuolumne Utilities District, and Twain Harte Community Services District. Number 4, adopting Resolution 9120 for signature delegation to the District Attorney for California Office of Emergency Services Unserved and Underserved Program Request for Application. 5, adopting Resolution 9220, vacating a public road easement known as Duffy Court. Number 6, approving the appointment of Matthew Rose to Area 12 Agency on Aging Advisory Council as a council member with a term to expire on October 6, 2024. Number 7, approving the appointment of James Grinnell to the Tuolumne County Commission on Aging for a term to expire December 31st, 2022. Number 8, adopting Resolution 9320, acknowledging report made by the Fire Chief of Tuolumne County Fire Department regarding compliance with the Health and Safety Code 13146.4, Fire Protection Services Inspections Compliance Reporting. Number 9, approving Tuolumne County Health and Human Services Agency to submit a grant application for the County Victim Services XC program through Cal OES and authorize the county administrator to sign all grant-related documents. Number 10, approving an agreement with Conti Corporation for implementation of audiovisual systems in the Board of Supervisors chambers to enhance online public access and participation in public meetings, which has been limited due to the COVID-19 health emergency.
Okay, would any board member like to pull an item from the consent calendar for further discussion? No? Okay, is there any public comment on the consent calendar? Okay. So we don't have any public comment for consent. I'll entertain a motion to approve the consent calendar.
Move.
All right.
Go
I
ahead. Move
have
to approve the consent calendar.
I'll second.
I have a motion by Supervisor Gray and a second by Supervisor Rotifer. Heather, would you please, or Clerk of the Board, would you please read the roll call?
Supervisor Brennan? Yes. Supervisor Campbell?
Aye.
Supervisor Kirk?
Aye.
Supervisor Rotifer?
Aye.
Supervisor Gray?
Aye.
All right. Motion passes 5-0. Okay, at this time, we'll move on to our 9 o'clock appointment. Clerk of the Board, would you please read our 9 o'clock presentation?
Presentation and planning status update of the novel coronavirus COVID-19.
Good morning.
Good morning, Vice Chair Campbell, members of the board, Ms. Carrillo, Ms. Riggs. My name is Rebecca Espino, Health and Human Services Agency Director. This morning, I'm excited to announce that our numbers of COVID cases has stabilized since our last presentation. These numbers once again demonstrate our community's commitment to make a difference by taking all the necessary precautions to reduce the spread of this horrible disease. I must also take this opportunity to acknowledge and thank Dr. Surjenko for his expertise, his professionalism, and for being so responsive to the board. Again, I also want to express my gratitude to our very, very talented public health team for their continued diligence to support this community through not only COVID, but their regular work that they try to do at the same time. Without further delay, Dr. Surjenko, Michelle Giacchetta.
Good morning, Vice Chair. Good morning, Board, and good morning to Chair Brennan, who I understand is staying at home, and I wish her recovery, a rapid recovery. So just starting with the numbers is, and I don't want to really go into details, we do have 17 new cases, including one death in the intervening time between the last time we met as a COVID update and today. I will say that as was said is that we're seeing a positive trend in what's called the reproductive effective number. It remains below 1, which means that we're seeing a decrease in the number of cases over time, and that's very encouraging as we were expecting a bump in the R effective in the post-Labor Day. So again, don't address that on this slide, but I think that reflects that we are seeing in the state of California and in the county a decreasing number of cases over time, and that's encouraging when we were expecting a slight bump. Next.
Sorry, Doc, what was that R number?
So it's what's called the R effective, or
Right.
RE for short, and that is a number that a number of 1 means that you're producing, if you're sick, you produce 1 sick person.
But what was that number? I'm sorry.
For us in Tuolumne, it's modeled out at about 0.95.
0.95.
And it's been stable at that. Similar for the state as well, just below 1 in the 0.9 to 0.95 range. So that's, again, very encouraging that we've seen that be stable over the last week. The governor, a week ago, had indicated that he was concerned that it was bumping up a bit, but that small bump up did not persist, which is, again, encouraging.
Thank you.
So as was indicated earlier, we've had a small number of cases, 1 to 2 per day, and that's actually to be expected. However, this does reflect some element of person-to-person spread where we know where that case is coming from. It does also represent some community transmission where we don't know where that case is coming from. And it also does represent some travel-associated cases. And I'll say, just as a personal insight, what I've noticed with both Mariposa and Tuolumne, going to Vegas is not necessarily a good thing because we've had a couple of cases in both counties have COVID that they got in Vegas and it didn't stay in Vegas. Next. So as we introduced at the last board meeting, we're now in what's called the Blueprint for a Safer Economy, where we get the updates announced to us on Tuesday based upon our average case rate per 100,000 and our test positivity rate. And in Tuolumne County, we are solidly in what's called the orange tier, our moderate level of transmission, or tier 3. And we anticipate that this is last week's slide, but we got an embargoed version late last night, and we anticipate that we'll be staying in orange for this coming week based upon the data that we just showed. Next. So Chair Brennan asked that we go a little bit into detail onto the Yosemite Gateway Area Coordination Team, which is one of the partnerships that we enjoy on a regular basis with other members of the community and county. So the Yosemite Gateway Area Coordination Team actually came about because I was interim health officer in both Tuolumne and Madera County, as well as the regular health officer in Mariposa. And our emergency management consultant felt like it would be a good way to get unity of effort across the 3 counties. And that was back in March 28th, I believe. And since then, it's evolved to not only the 3 counties where I've been serving as health officer, but also Mono County and Yosemite National Park. And I will say this is kind of a hierarchical chart, and it really would be better more showing a coordination. But we have a multi-agency coordination group, which consists of the board chairs of each of the involved counties and the superintendent of Yosemite National Park and their staff. They provide policy direction to the area coordination team, which includes, and we'll go into more detail, joint information, advanced planning, and intelligence and epidemiology. And then we coordinate efforts with the departmental operations centers in 3 of the counties. And then in Mono County, they have a unified command that runs an incident management team. And then Yosemite National Park has their leadership functioning through an incident management team. And then each of the DOCs, or Departmental Operations Centers, is supported by the county's Emergency Operations Center. And this results in a coordinated effort across the 4-county, 1-park Yosemite Gateway Area Coordination Team. Next. So to support that effort, we actually have a area coordination team where I serve as the area coordinator. My staff includes an emergency management technical specialist. Paul Bachroth is a consultant who has been working with us for several years on developing our emergency management plans. We have admin support and a safety officer to ensure that we get safe operations. We coordinate joint information with the public information officers in all of the 4 counties and in the park. And then to provide insight into what's happening, as a former military officer, we look at what's called intelligence. In the war against a disease, that intelligence is epidemiology. And so we have an epidemiologist and analysts that work with us to provide deep dives into the data, not only in the counties that we're coordinating with, but in our adjacent areas and throughout the state. We then have a planning section that provides advanced planning, looking down the road for weeks to months, and then an action planning unit that looks at a weekly operational cycle. In addition, we have a situation unit that maintains track of important documents, looking at and analyzing all information that's involved. Next. Then we're going to switch to testing, and Michelle has that for her.
Morning.
Morning.
We are happy to report that test results from the state testing site have greatly improved. At this point in Tuolumne County, at least 11,784 tests have been conducted. Tests are still available through local providers, Adventist Health Sonora, and the OptumServe state testing site, which is currently in Angels Camp. On November 3rd, the state testing site is planned to begin testing here in Sonora at the Motherlode Fairgrounds. The LHI state testing site has an average turnaround time currently over the past couple weeks of approximately 56 and a half hours. So just over two days. So we're really happy about Testing continues to be available at the OptumServe site while it's at the Calaveras County Fairgrounds. The dates and times are going to be the same when it's here in Sonora. That's 7 a.m. to 7 p.m. Tuesday through Saturday. Appointments are strongly encouraged, though walk-in availability is there. It's limited and can't be guaranteed, and they'll still have you register when you show up, so appointments are still strongly encouraged. Anyone can get tested. It's free of charge. You can make an appointment at the website lhi.care/COVID testing, or you can call 888-634-1123.
And I'll just make a comment on that. My whole family got tested last week, and it was a surprisingly easy process. So there's really no reason for anyone to worry or to stay away from testing. It's a we were able to get 3 kids through there tested, and myself and my wife, and we were in and out of there in about 20 minutes, and that's with registration and everything. So it's a pretty streamlined process now, and I think you've done a great job working out the kinks and getting people through the system. And then we got our results back in about 2 days.
Great.
So I can confirm anecdotally the information that you're bringing to us today.
Great, thanks for sharing that. So testing continues to be vital to the pandemic response. It allows for us to rapidly identify cases and contain the spread through isolation and quarantine. In addition, a reduced test positivity rate, that is the percentage of tests that are being conducted that come back positive, and the volume of testing provides an adequate amount of surveillance in our community, and also provides a positive impact on the Blueprint framework. Testing is still recommended as soon as possible if anyone is experiencing any symptoms. Also, every 14 to 28 days if people work with the public, and 5 days after traveling or having close contact with others outside of your family bubble. If you do have symptoms, self-isolate and contact your healthcare provider. Again, testing is available through your healthcare provider, the OptumServe site, and Adventist Health. They have a triage line that can be called at 536-5166. And also the valleycovidhelp.com website provides some helpful information. I'm going to hand it back to Dr. Surjenko.
So we're going to talk just a little bit more about the blueprint, seeing as we touched bases on it last week, or last time we reported to the board. And again, it looks at 2 measures: the case rate, which is the average number of new cases per day over a 7-day period, averaged over 1,000 population. And then, as Michelle was saying, the test positivity, which is the percentage of positive COVID tests in a 7-day period. And so, again, that's the second measure is an important reason why we want to be able to get people into testing in a convenient and easy manner. The other thing that we mentioned briefly last time was a health equity measure that has now been released and gone public. But I will say that we will not be impacted by the health equity measure in terms of actually looking at larger counties are looking at census tracts and addressing census tracts that are impacted disproportionately. However, we do have to, within our COVID plan, include some way of how we're going to identify and then address our impacted populations that may be impacted disproportionately. Michelle and I and the rest of the team will be doing that over the next coming weeks, and probably by the time we come back to the board in 2 weeks from now, we'll have an idea of that population. I'll say is I've delved into it with Mariposa, and really we're not looking at a geographically disproportionately impacted population, but rather looking at our hospitality industry, recognizing that they have close contact with visitors, and visitors are largely our at-risk group. We may do the same here, but again, that's a deep dive that we're going to be doing shortly. So again, looking a little bit more into the framework itself, those measures, the test positivity and the case rate, indicate both the burden of disease, that's the case rate, and then adequacy of testing, and that's the percent positivity. We can always be more restrictive than the blueprint puts forward. but my likely recommendation would be we not do that unless we see a large cluster that evolves rapidly that moves faster than the tiering mechanism would allow. And then, let's see, currently, and then the last bullet there I did want to mention is that I think at the last board meeting that we presented at, we talked about a small county variance. That is still very much in discussion, but knowing how the state moves, we could see something about that today, or we could be seeing something next week. But what it would allow is it would address those clusters. So if we had a large outbreak that would be larger than the numbers that we would be permitted in a 2-week period, but we knew about that and knew how we were going to contain it, they would look into that and then not move us into a more restrictive tier. But again, that is definitely a work in progress, and I'm waiting to, as I think all of us are in small counties, to see what the state will be coming forth with. Next. And again, as a reminder, we're in Tier 3, and that means that our concert venues, festivals, live theaters, nightclubs, saunas, and steam rooms are still closed, but everything else is open. Bars are restricted to outdoor operations, and as you can see there are other outdoor operations that can go on. We can remain in Tier 3 as long as we maintain a case rate of 4 to 15 cases per 7-day period over a 2-week period, and we maintain a case positivity rate between 2 and 4.9%. We can potentially move into Tier 4 if we have less than 3 or less cases in a 7-day period, and our test positivity rate remains below 2%. We've easily accomplished that test positivity rate over a long period of time. It's getting our case rates down to less than 3 cases per week.
And Dr. Surchenko, just real quick, by my numbers, and I don't have the state numbers, I have the ones that you report. And I know there's a time lag in there. But by my numbers, for the last 2 weeks, we've been very close to getting to the yellow. I had 3 the previous week and 4 this past week. So, I would encourage people that are asymptomatic to go get tested, because that will drive our case positivity rate down.
Correct. And the other thing, the real reason, or that is a good reason. Another reason, again, is to ensure that we're doing enough sampling in the community to ensure that we're not missing those asymptomatic cases. And just following on that, again, we'll start that last bullet, get tested. But the other infection control practices remain true. Do as we're all doing, wear a face covering, maintain that 6-foot physical distance, minimize contact with people outside your bubble. And then, as always, hand washing or hand sanitizing. And then if you are sick, stay at home. If you have close contact with individuals that you've been sick, ask them to quarantine. But that's, again, one thing that we've noticed is people that they recognize they have symptoms, but they still go on with their normal day, and that allows for ongoing spread, and we want to discourage that.
Just wanted to give a brief update on the Education and Compliance Division. They've been doing some great work. Thank them very much for that. We've had 296 complaints have been received related to 144 businesses. 107 of all the businesses that have had complaints have been resolved. It's approximately 74% of the facilities are successfully addressing the complaints that are brought forward. They've done 14 technical assistance of plan reviews, and all PPE and business-related expenses are being processed through the CAO's office, and the CAO staff are coordinating closely with the Education and Compliance Division to ensure that the funds are approved and processed and got out to the businesses in a timely manner. Business operating guidelines continue to be that businesses need to complete and operate a safety site-specific plan, post a copy in their business, and submit it to the Public Health Department at health@tuolumnecounty.ca.gov. Those plans are based on guidance documents by the state, which are available at the covid19.ca.gov website, and you can use the .gov/industry-guidance. You can also ask for assistance from the Public Health Department, and we're very happy to help businesses through that process. Also, the Tuolumne County Business website at tcdisasterassistance.com has some helpful information there to guide businesses in the right direction. Again, they can call our call center at 533-7440 or email us at health@tuolumnecounty.ca.gov. Communications and information, we continue to update our data dashboard on a daily basis. There's a bit.ly link here in the slide, but you can find that easily on the Tuolumne County Public Health website. Also by visiting our Facebook page, it's just Facebook, just search Tuolumne County Public Health. The official Tuolumne County website, tuolumnecounty.ca.gov/public health. And we also continue to maintain the community resources portal, which is bit.ly/TC COVID portal. Also a link available through the county website if that's easier to find. Our call center is still operational Monday through Friday, 9 to 5. That's the 533-7440. And again, by email. And that concludes.
I did want to address Supervisor Kirk had emailed me offline about flu and COVID, and that has been mentioned as a potential what's called twindemic. I don't know if I like that catchphrase, but that's what the media's come forth with is the idea or the concern is that we can have the impacts of both a flu season, whether it's a normal flu season or a busier than usual flu season, in combination with ongoing COVID infections. And so that's the reason that we're encouraging greater uptake of flu vaccine this year. So again, as Christine Herrera had mentioned, that we do have our drive-through flu vaccine clinics. I find that a tongue twister. But those are available as well as pharmacies and your own provider can offer those. That said, the preventive measures that we've seen for COVID have actually reduced transmission of flu in the Southern Hemisphere. So kind of what we do every year is look to the Southern Hemisphere in their flu season to see how bad our flu season might be. And so in Australia, even though they're seeing an increased number of COVID cases in Melbourne, they're seeing a decreased number of flu cases. So we're thinking that all of those measures that we take for COVID are impacting flu transmission. If we layer the flu vaccine on top of that, we, again, going into a flu season, don't know how effective a flu vaccine is, but typically we get 40 to 60% flu vaccine effectiveness. And then again, continuing all those measures that we're doing for COVID. And then Supervisor Kirk had asked about the possibility of vitamin D reducing the burden of disease. I'll say that's a work in progress. It looks encouraging at this point in time, but I would ask people to pay attention to what's coming out, and I think we'll probably have something more solidified in, say, the next month, giving it what I've been looking at the recent research.
Okay, so I'll have the clerk of the board read the public participation instructions, and then we'll take questions from the board before seeing if there's any public comment. Heather, would you please read those instructions?
If the public would like to comment on this or any item later on in the agenda, they can call in when the chair asks for their comment at 209-533-6581.
Great. Thank you, Dr. Surjenko. Do I have any questions from the board? Supervisor Rotifer?
Sure. Thank you, Dr. Surjenko, for helping us out. We really appreciate it. And I think that you and the whole coordination team are doing a very good job. There are a couple of concerns that I have with the way that the state is approaching it, certainly not with the way that the county is approaching it. But my concern does have to do with rural counties and the fundamental difference between rural counties and more densely populated counties. I've heard several people say, to include our previous health officer, that population density has not been shown to be a determinator. But being a data analyst at heart and understanding random collision theory, that doesn't make sense to me. Quite frankly, if I can walk from my house 4 miles to my office here And until I get inside this building, I can easily do that at any time of the day and stay 6 feet away from everybody. I cannot do that in San Francisco. Okay, so to say that population density doesn't factor into the equation doesn't make sense to me. And I think that just the random likelihood that people will come in contact with each other in a less dense populated area than a highly dense populated area means that some of the parameters that we're using should be different for rural areas than they are for the more concentrated areas. So I would really be encouraged to, or encourage you in your discussions. I know that RCRC and CSAC are both pushing rural county agendas in this regard, and I'm hoping that, and I'm sure you are, but I'm hoping that you and the coordination team are climbing on board that train, and I would encourage you to do that. And that goes to my second concern, which is I do believe, and despite our best efforts, I do believe that we will see as we go into the winter season, because that's the way viruses seem to work, that we will see an increase in COVID cases. And my concern is that we need to look at that rural county aspect, because I don't want us shutting down because we have a small bump, a predictable bump. I don't want us shutting down our businesses again if we don't absolutely need to. And quite frankly, I think we could be operating in yellow right now in most of the well, not most of them, but in at least 10 or 12 rural counties in the state of California that I'm watching fairly closely. So that's my big concern. It's not that we're being overly restrictive right now, although I do believe we are, but that we may end up in a situation where the state would be mandating us to shut back down, where I don't believe we need to. And I'd be very happy to have a conversation with you offline on that and what my concerns are. The other thing that I can't get my hands around, I'm sorry, I'm an inveterate analyst at heart, but we have, I forget the numbers, quite a few tests. Many of those were asymptomatic when they tested. It would be interesting if we could figure out how many of them never became symptomatic, and that would bring into question whether they were actually positives or they were false positives. And I'm not questioning the validity of the test. I'm not a chemist or an epidemiologist or whatever it is that figures out whether the test is valid or not. But that does raise some questions about the numbers and the data. And I'd be interested to know how many of those were asymptomatic and remained asymptomatic through their entire quarantine period or isolation period. I think that's important for the public. And I understand that people can have the disease and not develop symptoms and still transmit it. But I think that piece of information would be very, very important.
Great. Thank you, Supervisor Rodefer. I'll start with the last first and work backwards, if I may.
Sure.
So yeah, we do know we have asymptomatic transmission. And so the gold standard in a biologic is going to be a culture, and so a viral culture where you can actually grow the virus in a viral cultural media. But that's hard to do. So PCR is the sort of the gold standard for testing right now, and we do know that has a false positive rate in the single digits. But I think it is a valuable question to know how many or what percentage of the population has an asymptomatic case. I know I can do that for Mariposa now. We'll delve into that for Tuolumne and see if we can get the numbers for that. But I would assume that even with a percentage of asymptomatics, Some of those will actually have the disease and be able to shed it. We know 10 to 40% of people will have asymptomatic cases where they can have both a positive PCR and a positive viral culture, which means they're capable of shedding it. So that's, again, the concern and the reason we wear masks. With the rurality issue, I agree. And actually, sort of blending the first and second questions together, that is why we're working on that small county variance issue. So the support that we've gotten from RCRC and CSAC are critical in that, and making sure that those measures reflect, again, the impacts of a single cluster that can create a backward movement, if you will, for rural communities. So again, I appreciate that support. We are continuing to work on that towards a measure, and as I indicated, the state will be announcing that as early as today, but more likely later in the week. And then finally, with population density, I think it's a question of burden of disease. There have been a couple studies that have looked at population density, and I think the question is because there's population density, they're more able to mitigate the impacts of disease, so tertiary medical centers, et cetera. But an actual occurrence of disease, I would have to look at the two reports that I've read about that to see if there's actually more disease. But in terms of burden of disease, it's really a break even. And probably, again, rurality, fewer resources, urban, more resources, probably less disease in the rural, probably more disease in the urban.
Sure, and I think that that's important when we're looking at, especially when we're looking at our reactions as we bump it back up. If we've got an area, I would rather focus our resources on a specific area, and I look at Calaveras County as a good example. They're in worse shape than we are in Tuolumne County in terms of all the numbers, but I can look at, and they break it out by their district, but I can look at two commuter districts that are about 80% of all the numbers in their county. So three of their supervisorial districts are very similar to Tuolumne County, and the other two that are commuting all the time to Sacramento and Stockton are the ones that are heavily impacted. And yet the entire county is in a single response state. So I think I think that there's some things I hope we don't, but if we do, as we start to see a bump up as winter approaches and viruses normally do that, I would hope that we would be making the decisions on whether we're going to shut back down again or not based on focus our resources where they need to be focused. If it's in a specific area, let's focus on that. And certainly we want to focus our resources as we have been on those most vulnerable populations that are at highest risk for death, the elderly and those with complicating medical conditions. So that's my comment. Thanks.
Thank you.
Okay. Supervisor Kirk.
I'll take this off so I'm not so muffled. Thank you, Dr. Surjenko, for bringing those points up. I like you. It looks like you're looking at the same research I'm looking at, which is kind of why I brought some of those questions up. The reason why I asked you about the RO value, and I'm sure you already know this answer, but when we're looking at the flu, the RO value, I believe, is about 1.3 to 1.5. So we've actually, through the mitigating measures, mask, enhanced hygiene, all these drastic measures that we've taken, we've actually brought that RO value down, it looks like, below the flu RO value. So the reason why I emailed Dr. Surjenko about the vitamin D and about the flu is, there's been a lot in the media lately, and I've been keeping my ears tuned a little bit to what's going on in the UK, and they're talking about a second wave, a second surge. In New York, they're talking about it again. And for me personally, I feel like I'm kind of back to where I was back in March or April, where, I heard about this virus in China. started researching it, started paying attention to it, and then we all went through what we went through, March, April, May, and, it's carried us through. And so what's really concerning to me is, okay, is the second wave real? Is it legit? What are the numbers behind it? So I was up late last night in my office, and I was pulling some numbers together. And that compiled with, you have Newsom coming out. He said yesterday we have 21 states he's concerned about because instead of the line's no longer continuing to come down, now it's starting to flat out a little bit. Again, you have the UK, New York, and then we just recently had a lady at the Jamestown School Board who stepped down from the Board of Trustees, I believe, and it was because her concerns of a second wave coming. So as a supervisor, as a citizen, as somebody who's in the state of California under Newsom's governorship, I'm concerned about us going through a second wave, and I'm also concerned about what that is going to do to our businesses if they push another shutdown. So I have a lot of questions. I don't know if we have enough time today, but when I start pulling up CDC data, Dr. Surjenko brought up the same data I looked at, which was in the Southern Hemisphere. And again, this is trying to just get the facts straight. When we're talking about a second wave, the Second Hemisphere isn't experiencing really much of a flu. In fact, with the data that I'm looking at, the RO value for flu this year per CDC may be below 1.0. That's because, again, mask wearing, all the enhanced hygiene we're doing. And then when I look at graphs that summarize the UK, and they are starting to see a second surge of positive cases. Again, when this whole thing started back in January or February, March, April, we didn't have any testing capabilities. So now that we have the testing capabilities, of course we're seeing that huge wave because we're getting much more tests done and even more rolled out. I think I forget what the study or what the news article was, but I think the world's going to get 130 million throughout the world for test kits, but yet here in America we're going to get 100 million. So per capita we're going to be kicking butt compared to the rest of the world as far as testing. So we're going to see, as we take more tests, we're going to see more positive cases, but then when I look at the actual death within 28 days of positive case, I mean, it is drastic. I can't show you on here because it's so small, but test positivity up in April is up here, but yet the death rate right now is at, make sure I'm interpreting this right. Well, I don't want to try and interpret this wrong. That's kind of why I want to have a future discussion, but what I'm trying to say is I'm afraid that if there's a second wave, people like Dr. Surjenko who can analyze the data and I believe make informed right decisions, I'm afraid that this is going to get politicized because the death rate's low, the ICU rate is low, the case rate per death of 100,000 is low. And so we're having the media freak out. We're having people step down from school boards because they're afraid of information that's being portrayed, but then when I go and I look at the actual hard facts from CDC, it's not what's being discussed publicly. And so I'm not a doctor, but I'm not going to sit up here as a board member and refuse to make educated decisions when I have data coming from what appears to be legit sources. So what I'm trying to get at, and I guess what I'm concerned about, like I've said a couple times, is the flu season, people taking care of themselves, but also not misinterpreting the data. And so, again, I have a lot of information I pulled up yesterday. I wasn't able to email it to you in time, Dr. Surjenko, because I'm still digesting it, still trying to figure it out. But for me, what I like to see, I don't know if it's going to be at the next board meeting or if between now and that next board meeting, if we could call together kind of like an emergency meeting. But I would really like to talk about this data specifically and give the public an opportunity to listen in, because I know a lot of the conversations and questions that we have gets resolved maybe behind closed doors, but I think this is going to be very important to have this conversation because, like I said, I think we're going to enter a second wave, and if we don't analyze that data correctly, I think we're going to repeat some mistakes that we did this first go-around.
Okay, so are there any other questions for staff?
So no questions for staff, but just at the end of this, if we could maybe discuss as a board having a board meeting in between the next two or putting on the agenda at the following board meeting to have a a thorough discussion. I have a lot of data I
So
want to present.
What
and
I'm
ask
going to
questions
recommend
about.
is, Doctor, are you available to discuss some of these finer points with Supervisor Kirk, and then you could share that information that you gleaned from that conversation with the rest of the board?
So I have a private conversation
Well,
with
it doesn't
Dr.
You could have, it doesn't have to be private. It's up to you.
No, what I like to, I think, listen, this is, the reality of what's happening is they're talking about second wave. Newsom's already talking about going into a second shutdown. If we don't, as a community, come together and understand this data, and if the data justifies things that might be coming, so be it. But I'm very concerned with the data, and I think it needs to be a public conversation with our community at large, and not another hush conversation.
Okay.
Question.
So I would recommend you arrange that public conversation in any way you like with
Okay.
Dr. Surjanko.
No, with the board. I think the board needs to be, we're the decision makers for our community.
Can I have
So I think we should all be educated.
You are the one that has these questions.
I have the same questions, so.
Okay, so
We should want to,
I would share your questions with Dr. Surjanko and come back with an idea.
well, let's finish up and then we can decide, because
Of what
we are
you are
decision makers for our
talking
community, and
about
if
here.
we don't know what is going on, we're going to repeat some mistakes.
Could I just
Yeah.
get,
please.
Let
one word
Yes,
here.
I'll
Supervisor
stop.
Gray have
I just want to ask Dr. Sajeko on what he feels the value of this type of discussion would be public-wise. I'm not afraid to have it, obviously, but is it going to be something that's going to change what happens, or is it, are we just going to go through a bunch of hypotheticals, what ifs?
So from a public health standpoint, it's always important to communicate with the public and gain their trust. And so in terms of an understanding of where we could possibly go in the winter, as Supervisor Rotifer indicated, there is the potential for a second wave, and that could occur with a flu at the same time. And getting to Supervisor Kirk's question about getting that granular data, I think we're already looking at things like hospital rates, hospital occupancy, moving into surge, regardless of whether it's flu, COVID, or not. So, again, that's something we monitor on a regular basis, is the ICU and med surge bed occupancy and the percentage of those that are. I'll lean in a little bit more. So we're monitoring hospital data on a regular basis. We're looking for that surge to happen because, again, if it's a bunch of, and I shouldn't say, if it's an increased positivity rate without an increased burden of disease, then it may not be necessary to have as stringent a shutdown as we had back in March. We know every time that we ease up on restrictions, whether it be June, July, is that we do start seeing a bump in cases, and we do see a bump in hospitalizations and a bump in deaths. And so those are things that we monitor closely. I would suggest as a way forward is if Supervisor Kirk would like to send to me, and the person that I CC'd on that email is Dr. Allen. She's my senior admin analyst, PhD in public health. And so between the two of us, along with the staff here in Tuolumne, we could answer some of those questions. And then I would defer to the board on how you would like to conduct that in a public forum. But I think if we get you the answers up front, and then you can inform the board, and you can have the discussion based on that, that would be a possible way forward.
I would be interested in participating in that offline meeting. Pardon me, offline meeting as well.
I want to give Supervisor Brennan an opportunity. She's been waiting patiently. Supervisor Brennan, do you have any comments or questions for Dr. Surjanko?
No real questions. Just I want folks to also remember going forward, we're going to continue to look for some of these answers. And again, I think a lot of it is around this rural county variance. But excuse me, remember the personal responsibility piece also, because I'll be honest with you, I think I have a head cold. I have been tested. I don't have the results. But nobody would want my head cold. And so if you're feeling under the weather, isolate, stay home. Remember that we need to get as much of this testing done, but we need to take personal responsibility and respect our neighbors, and especially respect those out there that are vulnerable. And I think that will go a long ways in helping us also.
Okay, thank you. All right, I wanted to see, is there any public comment? Okay, we do have some folks that have been waiting to comment, so we have one person. I'll ask at this time if there's any public comment to go ahead and call in. Okay, go ahead.
Yeah, a couple comments and questions for Dr. Surjenko. Can you tell us of the 230 people who have tested positive, how many of those were retested, and what were the results? Were there any false positives that were found?
Are vulnerable, and I think that will go a long ways in helping us also.
Do you have an answer for?
So that's something that I don't know if Michelle has off the top of her head. I do not.
I don't know the numbers right off. I assume that you mean retested at, like, to end the isolation period, or like a confirmatory test?
Well, the New York Times had an article where they were claiming that as many as 60 or 70% of the tests were in fact false positives. And so when people do get a positive test, do they get retested, and do they get retested by a different company, because some of the testing procedures give more false positives than others? Do you know if that's been done?
Yep. Do you want to answer it? Or? No, I mean, there have been a couple of the labs. When the Adventist Health Sonora in-house lab first opened, there was a period of time where they ran all tests for a confirmatory follow-up test through the public health lab. They no longer have to do that because they've, I can't remember what the term is, but they don't have to, yeah, validation. And I don't have numbers off the top of my head if any of those came back. I'm not at least aware of any large numbers of positives that came back negative the second on the confirmatory test.
So of the 230 cases, there may have been some false positives, but they haven't been deducted necessarily from the 230 number that we've got.
Okay, thank you very much for this comment. So did you have any final insights on that question? Okay. Is there anyone else waiting?
Well, wait a second. Were you talking to me, or were you talking to the health officers?
So thank you very much for your comments.
No, I wasn't. I just had a couple other questions.
Well, it's not a question and answer phase. You have to.
Okay, well then let me just make a couple of statements, because
you've asked your question, so I have to move on. I'm sorry, it wouldn't be.
No,
fair
I
to
got
people
3 minutes,
commenting.
and you're cutting me off. Come on.
Okay.
Look, I've sat on the phone here
you
for
have
over
some
an
time,
hour
Bruce.
to do
So
this,
go ahead and answer
you're
the rest of
cutting
your
me
question.
off, really?
Bruce, are you listening? You have some time
Yeah,
left,
I
so
am.
go
Are
ahead
you
and answer
listening?
the rest of your question. Ask the rest of your
Okay.
question, please.
I'd like to know the efficacy in terms of contact tracing. Have they found any positives as a result of contact tracing?
Okay, thank you very much. So the question was, what is the efficacy of contact tracing? And
So do you know the? So I can't speak for the Tuolumne data, but I do know that we have in Mariposa, which I'm much more familiar with as the full-time health officer there, is that we do have positives that are associated with contacts, and that typically those become positive 4 to 5 days post-exposure. And of the 76 cases that we've had there, I'm going to say roughly 10% of those were, actually probably a little more than that, were related to being close contacts to known cases that we'd identified through contact tracing, isolation, and quarantine.
Great. Thanks, Dr. Sajenko. That's it.
All right, thank you.
Thanks, Bruce. I would say we could pull the data. I don't have it off the top of my head, but contact tracing is effective, and we do find contacts who were quarantined as contacts of a known case, who then do become positive during their quarantine period. So we could pull the data if you want to know, if that's helpful information to know the number.
I didn't catch the last part of your comment there.
We can pull the data if it's
Okay.
helpful to know the numbers and present that next time or provide it to you, to the board.
Okay, I thought it might be interesting to see. All right, any other comments from the board or questions?
I would be in favor of what Dr. Sajenko's recommendation is as far as moving forward with Anaya's questions and Carl's questions.
Yeah, and I can agree to that too. I'm more focused on not actually hashing out the details of what the data says more than I am interested in how we can use that data to make informed decisions about how to respond to this. So that's why I'm a little hesitant to want to go into the nitty-gritty of the data right here in this platform, because it would be it could do more harm than good if we're going into areas that don't necessarily. It could do more harm than good if we're going into areas that don't necessarily impact the decision making that we need to make in Tuolumne County. That I guess that's my only concern. So I'd say if there's some way that, Supervisor Kirk, Supervisor Rotifer, you could get together with Dr. Sajenko, work out some of those details in a more solidified way, and then we can have that discussion on how that information impacts our county directly.
Well, so what I'm going to do is
does that make sense?
I'm going to compile some data, some information, some questions I have. I'll get with Supervisor Rotifer, see if there's anything that he wants to add. Present it to you, Dr. Sajenko. If you and your team could answer the questions, and then we could go back and forth a little bit about what it means, and then maybe at that point we could bring it before the whole board. I don't know if it'd be a special board meeting or set more time aside at the next scheduled board meeting, but basically to discuss that info and how it might be interpreted moving forward. Does that sound about right?
Okay. Are you good with that, Chair Brennan?
Yes.
Okay. I do have one last concern, and this is really for the public. But it's also, I think, for our team. I think we need to recognize that, at least in this county, I think we're losing public support on a daily basis for our COVID procedures. I'm seeing more noncompliance every day. Not terribly, but I'm just seeing it. And I think that cumulative fatigue is starting to wear on our public. And it goes to Supervisor Brennan's comment about the need to really stick with the protocols that we've got out there. It's important. That will minimize the bump if it does come. And I'm pretty sure it probably will. And it will minimize the potential for us to have to go back into a more restrictive set of protocols imposed by the state. So I think it's a two-sided sword. On the one side, the public needs to hang in there. Okay. On the other side, I think that we need to be looking for ways to minimize the fatigue that's on the people and maybe increase our messaging a little bit to encourage public support. Thank you.
Okay. All right, so I'm going to move on. We have a bit of a technical issue with our Wi-Fi, so I'm going to look to the board members. Are you okay proceeding without the board packet available on your computer? I've been looking at my phone and I'm able to get it here.
Thank you.
Okay, so we will take a short break. We'll reconvene at 10:20. All right, we're back from recess. We'll move back onto the regular agenda. Item 11. Clerk, would you please read item 11 on the printed agenda?
Item 11, consideration of adopting Resolution 9420 proclaiming October 4th through 10, 2020 as Fire Prevention Week in Tuolumne County.
Okay, do we have anybody presenting for item 11? Okay, so we're going to hold off on that. We'll table that and move on to item 12. And before we do, Clerk, would you please read the instructions for public participation one more time for me?
In order for the public to give public comment, they must call 209-533-6581 when the chair calls for public comment.
Okay. And then would you please read item 12?
Item number 12, consideration of establishing three-way stop controls located on Main Street at the intersections of Donovan Street, Saco Street, and Willow Street in Jamestown by adopting an ordinance amending Tuolumne County Ordinance Code Section 10.16.050, first reading.
Good morning.
Can I make a comment on the front end of this? Since this is in my district, and actually this is the reason we're bringing this forward is at my request and really at the community's request as a response to the increased traffic and high-speed traffic going through Jamestown because of the backups on Highway 108. And so I just wanted everybody to be aware of that as the presentation unfolds. Thank you.
Thank you.
Yeah, so good morning. Kim McFarland, Director of Public Works, and as Supervisor Rotifer said, he has been asking us to come up with a solution for over a year now. We did install radar feedback signs, and we did have CHP present themselves with a greater presence downtown, but unfortunately the problem persisted. And in the last few months, Dave Ruby, Eric Pearson, and Tanya Sanguinetti from our engineering team assessed various options for traffic calming. They met with the local merchants on site, and they're here today to present a recommendation that's been vetted through the Jamestown Promotion Club. Thank you.
Thanks, Kim. I'm Dave Ruby, your civil engineer for the county, and this morning, we wanted to here this morning to talk to you about whack-a-mole. It's a game that if you have kids, I'm sure you've played it before. If you have grandkids, you've probably played it with your grandkids, but it's one of those games where you have a table, a little mole pops up, and you have to smash it down with kind of a bumper, and then it goes away. But not for long, because another one pops up somewhere else, and you have to get it too. And in our world of civil engineering projects for the county, we play whack-a-mole an awful lot. We really do. We get big problems that pop up in the form of a dangerous corner, or maybe there's a lot of traffic that builds up in a location, and we study it, we throw resources at it, we throw money at it, we make a project and we smash it down, and then sometimes another one pops up right after we've solved the problem, and we didn't anticipate that. And I think if any of you have visited Jamestown on a weekend or at rush hour, you know that we have a bottleneck there, and we have a lot of traffic that we can't seem to get rid of. And we've done some different projects in the past. We've signalized Rawhide there several years ago, and that has helped some. We've signalized Fifth Avenue, and that's helped some too. But we have little moles popping up in the form of other folks when traffic backs up using Main Street as their get around. And in the big picture, help is coming. We have a really large regional project working with our partners at the TCTC to plan it, and with Caltrans to widen Highway 108-120 through Jamestown, 49-108 through Jamestown. But that one's out of ways. It's scheduled for about 2030. In the nearer term, we have a project, Caltrans working with the county, also with TCTC, on improving the bridge and reconfiguring the intersection at Rawhide Road. and synchronizing that signal with the new signal at Fifth Avenue, and that should help. But in the nearer term, we've had a lot of issues with Main Street. As Kim introduced and said, our team, responding to a lot of complaints, has tried a couple of things with our roads crews. So far, that hasn't been too effective. We decided we'd go take a closer look at it, and we've reached out to the Jamestown Promotion Club. Garnered a lot of good feedback from that, talked to a lot of business owners. On another occasion, started to come up with some ideas. Our new engineer, Eric Pearson, did some top-notch research on different tools in the toolbox that we could use to maybe take care of the problem. And then I did in-depth geometric study of the whole Main Street corridor to see what might be feasible and what might not. And so what we bring to you is our conclusion, looking at some of these different possible traffic calming measures to quell the traffic speeding through Main Street. We looked at what's called a horizontal shift, which would be a speed bump of sorts, or a traffic table. And those can create drainage issues, and we don't really want that on Main Street. We looked at a vertical shift, which would be like a lane shift where you have a chicane or maybe other things that constrain the way that you have to kind of slow down and go around. But we don't have enough width on Main Street, which dates back to the 1850s, before cars were even invented. And so projects of that nature would take away a lot of the parking opportunities on Main Street, and we don't want to discourage parking on Main Street. So we're kind of running out of options, and eventually that led us to the addition of stop signs and adding stop signs at 3 of the intersections on Main Street, and that is the recommendation that we bring before you today as a near-term solution to slowing the traffic down and making it less desirable for folks to use as a workaround to get around the traffic signal. We recommend the installation of 3-way stops at the intersections of Donovan Street, Seco Street, and Willow Street as well. And we believe that that will also be a boon for pedestrian safety as well. And we want to look into improving the crosswalks at those 3 intersections to bring them up to ADA compliance and make them safer. And I think it's going to be a really good thing as well for the businesses, because if we can get the motorists that do go through there to slow down and pause a little bit, they might have a look around while they're still in the car and decide, hey, I'd like to stop there and have a meal or visit that shop. So we think this has some positive benefits in the near term while those other big projects are in the works, and we like to see if it makes a positive difference. So what I'd like to ask your board to consider today would be to establish 3-way stop controls on Main Street at the intersections of Donovan, Seco, and Willow in Jamestown, and then also to adopt the change in our local ordinance to waive the first reading of the ordinance amending Tuolumne County Ordinance Code Section 10.16.050, and then schedule the adoption of the amended ordinance for the next meeting, which is October 20th, 2020. And we're here to answer any questions that your board might have regarding this action.
No question, just a comment. It just seems like a sensible solution and probably one of the least expensive ones that you
It is indeed the least expensive solution that was on the table for us.
Thank you.
Any other questions from the board? Sherry, any questions?
No, like the solution.
I had one question. How does any of this tie in with either the active transportation plan or with the congested corridor plan, or is this strictly a county project? Is there any way we can kind of incorporate some of those funds or those opportunities?
At this point in time, it's an unbudgeted county project that would be handled by Public Works. I believe we have some support staff that work within our roads department that would handle it. Scott and Jarrett are two guys that are top notch in planting signs and painting stop legends and bars. So we can keep it in house and keep the costs down on that.
Okay, great. Just some of the elements of it you mentioned, the improved safety for pedestrians, that, and then decreasing the speed along that road, all things that I'm sure the majority of people would really support. Seeing a lot of that ties in with some of the active ATP stuff that we've been looking at on the Transportation Council. So.
Yeah, absolutely. And we do have an application for an ATP grant to do pedestrian and bicyclist enhancements on the 5th Street corridor in Jamestown, tying it kind of into the improvements that are down there to improve that along the school frontage and all the way down to Railtown. But at this point in time, that corridor is linked to the Main Street corridor by our Walk of Fame, which was built a few years ago. And that's kind of a really neat little community enhancement that Jamestown has to boast about. But at this point in time, yeah, it's not really officially linked to an ATP project and would be difficult to do.
Great. All right. Well,
and I think that there is a sense of urgency down there. We've been dealing with this, as Kim said in her opening, for more than a year, and I'd hate to see it get delayed in any significant fashion. We're kind of committed to try and get this through this month and get the stop signs put in, because it is day to day. It is and has been, and until we put some stop signs in there, it will continue to be a serious public safety issue down there.
All right, I'm looking to the back to see if there's any public comments. All right, no public comment. Are you looking for an action from the board on this item?
Yes.
Yes, we are.
Okay.
So I move on staff recommendation to waive the first reading and set a second reading and possible approval of the action at the next regularly scheduled board meeting.
Second.
You have a motion by Supervisor Rotifer, second by Supervisor Gray. Clerk, would you please read the roll call?
Supervisor Brennan?
Aye.
Supervisor Campbell?
Aye.
Supervisor Kirk?
Aye.
Supervisor Gray?
Aye.
Supervisor Rotifer?
Aye. Thank you all.
Thank you.
Thank you very
Motion
much.
passes 5-0. Thank you
Thank
very
you.
much. Okay, so we'll move on to item 13, which involves our wonderful auditor controller. Clerk, would you please read item 13 on the agenda?
Consideration of adopting Resolution 9520 for appointing special district members in lieu of an election pursuant to Election Code Section 10515.
And I have my other hat on. I'm the County Clerk, Register of Voters, Debbie Batista. Per Election Code 10515, the Tuolumne County Board of Supervisors appoints candidates who qualified and filed for election for special districts. However, that race either had equal to or less than the number of candidates running as there were seats. So you have a list from some of the special districts where candidates filed, they qualified, but the race was 2 people filed, there was only 2 positions. You don't go to a ballot if there's only 2 and there's only 2 open. So what we're asking you is under the election code to appoint these people as if elected for all of those different positions.
Okay, any
questions,
comments on that? This is sort of a typical
straightforward.
part
I wish
of how...
I wish district supervisor positions were like that.
They are not. They don't qualify under this. Only special districts qualify under this. Would be nice. I wish the auditor controller would have fallen under this. If nobody ran against them, they shouldn't be on the ballot.
Any questions, comment from Supervisor Brennan?
No.
Any public comment on this item? Okay, I'll just say thank you very much to the people who have chosen to contribute to their community in these ways. And it would be nice to get in without an election, but we need people to fill in these very important positions on these service districts. And so thank you very much for your service, and thank you, Registrar of Voters, for bringing this to us.
Thank you.
Are you looking for a vote?
Of course.
Okay.
It's a resolution.
So I'll entertain a motion to approve this resolution.
I'll move on staff recommendation, and with also my comment of thanks to the people that are stepping up to serve their community.
Second.
Okay, a motion by Supervisor Rotifer, second by Supervisor Gray. Clerk, would you please read the roll call?
Supervisor Brennan?
Aye.
Supervisor Campbell?
Aye.
Supervisor Kirk?
Aye.
Supervisor Gray?
Aye.
Supervisor Rotifer?
Aye.
Okay, motion passes 5-0. Okay, so so we'll move on to item number 14. Clerk, would you please read this item?
Consideration of awarding agreement to Roebling Construction Management, Inc. to provide construction management and special testing services related to the county's Community Resilience Center project.
Ready?
Good morning.
Good morning. Maureen Frank, County Administrator's Office. This item and the preceding item are both related to your Community Resiliency Center projects, and I'm excited to bring forth these items to you for consideration. The first item before you is an agreement with Roebling Construction Management and also Special Testing Services. As your board is well aware, the Community Resiliency Center's plans and specs are almost complete. We anticipate going out to bid in January with the expectation of being under construction April 2021. It's time right now for us to procure the services of construction management services and special testing. As you might be aware, a construction manager firm is our eyes and ears out in the field. They're the ones day to day working with the contractors and making sure that we stay on budget and stay on time. The special testing services is a requirement of the building codes. We are required to have an independent third party, if you will, firm come in and inspect things like the strength of the rebar, the slumping of the concrete, making sure all the bolts or reinforcement that is required for and called out for in the plans is actually put into place out in the field. So with that, the county staff sent out a request for qualifications for these services last June. At the close of the proposals, we received six different proposals from qualified firms, all of which are located in the state of California. These proposals were then reviewed and ranked by the review committee, and the review committee was made up of Terry Cox from Cox Consultant, Brian Bell, our chief building official, and myself. The firms were rated on the following criteria: experience of the firm, experience and qualifications of the proposed staff, understanding of the project and the proposed project plan, and the availability of resources that these firms would put towards our project. Oops, excuse me. With this, the top three firms were then interviewed. It was Consolidated, CM, Kitchell, and Roebling. After looking at all three firms, and all three firms were well qualified and could do the job, the review committee felt that Roebling Construction Management had the best approach to the project. They seemed to really understand the fiscal constraints and commitments we had towards the project and the timeline, and were willing to work with us on all three of those items, knowing how important they are to us. So before you today, for consideration, is agreement with Roebling Construction Management for construction management and special testing services for both community resiliency centers. The special testing services will be provided by Consolidated Engineers Laboratory. The amount of the agreement, of this agreement before you, is $874,814. And if signed, will commence October 15th, 2020, and will run through September 30th of 2022. The cost, again, for this agreement before you is out of the National Disaster Resiliency Competition and is not coming out of the general fund. The agreement has been reviewed to form by your county council. I'm here to answer any questions you may have.
Mo, do we have to get any state approval of the contractors that we pick on this?
No, what we do have to have, Supervisor Gray, is approval of housing and community development on the process that the county followed. So we have given them all the processes ahead of time, and they're fine with it. So they do not have to approve this.
Thank you.
You're welcome.
I'm jumping the gun a little bit, but item number 15, were we able to utilize that process with this group?
We did not do a pre-qualification process for the construction manager.
Do we need to?
I don't. In staff's opinion, no, I don't think you need to.
Okay.
It's really, well, I don't want to jump the gun. My attorney is probably telling me I would like to wait and talk about why it's important for a contractor to go through pre-qualifications.
Okay. So these guys are managing the project, on keeping everything on budget. Should things go over budget, would it be on their hook, on their dime?
No, it's still on the county's hook, Supervisor Kirk, if we go over budget. But they're the ones that are really looking after things and watching things. For example, one of the first tasks that they will get right after the contract is signed this afternoon is going through the plan set and making sure that there's no conflict between the trades. So when there's various trades out there in the field, one set of plans for like electrical doesn't conflict with what drywall's doing, for example, and things like that. So there's a lot of things that we'll ask Roeblen to do to make sure that we don't have problems later on in the field. So they'll be starting their work as soon as possible.
Okay. And I'm not trying to throw a monkey wrench in.
No,
Just
it's okay.
if they're that critical and responsible for the budget side of things, it'd be nice to know their background, but I'll leave it at that. I guess we'll talk about item 15 when it comes up. But
any other questions from the board? So in this, the process of hiring Roeblen, because you do have some information here about their background. I mean, hiring a firm like this, and correct me if I'm wrong, part of the purpose of this is you are spending money to hire a firm in the interest of increasing efficiency so that the overall cost to the project is less and that it's done within the time frame that we've set.
Absolutely, you're correct, Supervisor Campbell. So what a construction management firm gets in there and does is work with the contractor and making sure that there's established procedures and policies are adhered to, that every month when we get a pay application, they're looking at the schedule of values and reviewing the schedule of values and making sure that the contractor is not asking any more than he or she should be for any item that they're requesting payment for. They're making sure that they're requiring with the Water Quality Board procedures in regards to making sure the project is safe and we're not having dirt tracked off of the site, or making sure that water is not leaving the site that shouldn't be leaving the site. They're going through and making sure that the items, all the submittals, all the items that we've asked for, windows, doors, carpet scheduling, has been installed per plans, per specs. So they're, again, the best way to put it, their eyes and ears out there on a day-to-day basis, and Roeblen will be there on both projects every day of the week during construction.
I think one of the important aspects is make sure that the scheduling is correct. You don't want, like Mo said earlier, different contractors stepping on each other's toes, and that takes somebody right there at the time to make sure it doesn't happen.
And just so I'm clarifying what my concern was I get that. It's just if our county is financially gonna be on the hook based on their interpretation and their ability to do this job, I would think that we would do background checks like we were gonna talk about in 15. I would think it would be just as important, if not more important. So if somebody wants to.
Explain how you came to the conclusion that they were the best.
Right. So, for example, I read off the criteria that we were looking for, and it was so important for us. We just didn't go off of the proposals that we had. We also looked at, we had interviews with these firms, and we spent over an hour and a half with each of the top 3 firms. And those are the things we looked at. Have they done similar type projects? Have they done projects of this magnitude? Were they going to be able to handle 2 projects in 2 different locations? What was the stability of the firm, and how long have they been in business, and what was their reputations?
Well, I'm not questioning your team. I'm not questioning your teams at all.
I understand,
but I know, like from things I've heard about some of our prior projects, is had we gone to some of those projects that they completed and spoke with their counterparts, we would have heard that they weren't reputable or they weren't as great as they were. So, was there any background checked on this organization?
So yes. So I'm sorry, excuse me, Supervisor Kirk, I apologize for stepping on you. So in their proposal, we required them to list references. So give us similar type projects and give me the amount of the project, give me the timeline in which it was supposed to be done with and what happened, and give me a reference contact. And those contacts were made, and everyone I contacted had glowing remarks about their performance.
Perfect. You answered my concern, which was
Okay.
Just going deeper than just.
But what we're going to talk about is so much more in depth.
Right. Okay. Just because you're reading 15, it got my cue going
Yeah.
about. Okay, so you answered my question.
Okay.
Okay, any public comment on item 14? Okay, seeing none. Are you looking, I guess we're looking for a motion on this item?
Yeah, Mr. Vice Chair, I move on staff recommendations, and really happy that we're moving things.
along.
Thank you.
You're welcome.
And I will second, and thank you for answering my questions.
You're welcome.
Okay, I have a motion from Supervisor Gray, second from Supervisor Kirk. Will you please read the roll call?
Supervisor Brennan?
Aye.
Supervisor Campbell?
Aye.
Supervisor Kirk?
Aye.
Supervisor Gray?
Aye.
Supervisor Rotifer?
Aye.
Okay, motion passes 5-0. Thank you very much.
You're welcome.
Okay, so move on to the next item.
Consideration of approving pre-qualification of bidder process for the Community Resilience Center project.
Okay.
Welcome again.
Thank you. Maureen Frank, County Administrator's Office. This item before you for consideration it came out from the board really asking county staff to really look at our best practices and really look at how we are doing business with contractors specifically. And so after doing some research, both from County Counsel's Office and the staff, we're here before you today to ask for your review and approval of a pre-qualification of bidders process for just the Community Resiliency Center projects. As mentioned in the previous board item, we're almost done with plans and specs. And we plan to go out to bid with this project in January of 2021, with bids awarded in March and construction starting in April. The California Public Contracting Code 20101 allows counties and public agencies to require licensed contractors bidding for public works projects to pre-qualify for the right to bid on a specific project, or on all projects out to bid on an annual basis. Although this law has been in place since 1999, we in the county have not exercised this or gone down this path of doing it. But as we said, due to past problems that we've had with contractors, county staff is here before you today to recommend that for this project that we go for a pre-qualification of bidders for this project. Before you in your board package is we put together, both county council and this county administrator's office, procedure for pre-qualifications and also an appeal process that, if approved, we would utilize for this project. These guidelines were then developed based on the California Department of Industrial Relations We modeled it after that. The process is basically this. A construction pre-qualification package would be then advertised and sent out to local our business exchanges, our construction business exchanges that we usually use. It'd be advertised in the paper. The package is, as you see, as we went into, contains general contractor information about their business. It talks about and asks the business about the firm's resources, their financial assets, their ability to do the required work. It asks about their safety record and also their staffing capabilities. As your board is aware, the current procedure requiring selection of the lowest responsive and responsible bid does not allow us any significant investigation of a firm or its reputation, or the benefits of pre-qualification would be to discover those and avoid bidders with a history of poor performance. Once the pre-qualification packages are returned, then they'll be reviewed and vetted by both the county administrator's office, county council, and then a construction management firm selected for this project. In this case, we just selected Roblin. Once we reviewed them, then we would follow up with reference interviews. So we would go through and talk to the references that those firms have given us. The firms that are approved will then be placed on a pre-qualification list of approved contractors for this project. Then when formal bids go out, and those will go out in January, in early January, those are the ones who have been pre-qualified will be allowed to bid on this project. Even though the overall timeline for the CRC project, as you know, is extremely tight, county staff feels that we have plenty of time to implement the process and still meet the grant requirements. There is a schedule in your board memo, but what I just handed out is a more thorough schedule, so you can see from October 9th to April of 2021, I've outlined what processes will transpire and how we'll be able to get this process done if your board decides to go with a pre-qualification procedure for this project. And with that, I'm here to answer any questions.
Just comment, this gets rid of the frustration of dealing with that lower bidder all the time, and I think it's just really the right way to go. Supervisor Kirk, that gets us out of the situation that we have been in on a couple of our projects that you're aware of, that you want to get a good contractor, but sometimes that lowest bidder is not always the best. So this is a really good step forward. Thank you.
Yeah, and I agree, and I'm just curious because obviously it says CRC project schedule, but will we be utilizing this for all projects moving forward?
That's up to your board. So right now, the only thing in front of you is staff and county council is asking you to approve it for this project.
Okay. Well, I would think it would be good to use for if we ever have other projects. But I agree with John completely. When I was building my home and I was getting bids, I don't think I ever went with the lowest bid. I always went with the most reputable and do all that background check.
So let's make one thing clear, is that we still, so once you get the pre-qualification list,
still going to be the lowest bid.
Yeah,
it's still going to be the lowest bid once we then go to the process. Right. But what we'll be able to do is see that a contractor is fully bonded, and they have a good safety record, and they have the assets enough to be able to secure and do the services that we're looking for. They will have the capacity and the equipment and stuff to do the project. So it'll give us much more assurances ahead of time instead of maybe dealing with contractors that are struggling to be able to make it through the project, and then that causes other problems.
Right. Okay. Thank you.
Yeah, I think this is long overdue. I would encourage staff to pursue this avenue in any major future construction contract in this county, because if you don't preclude some wild card from getting into the deck and messing the whole thing up, as we've seen in the past, and our hands really are tied once we do the bidding process to go with the lowest bidder. So we need to make sure that they're all at least qualified to do the work before we open it up. So I'm all in favor of it.
Supervisor Brennan?
Yeah, I agree, and I appreciate the timetable that you've laid out, and looks like a pretty aggressive timetable that will keep us on schedule, and I fully support this.
Yeah, and I also very, very much support this process. We had something similar to this with tree mortality, where we had a RFQ process where any contractor that we worked with had already gone through a vetting process to show us that they were at least minimally qualified and had the kind of experience and safety record to be able to complete any future jobs that we might have for them, be able to complete those jobs successfully. And so it just gives you another vetting process to make sure that you're hiring the right people for the right job. And I fully support, bringing this forward on future projects that might arise. And in a lot of ways, this actually streamlines, maybe not in this particular case because we're starting, but for future projects, this could really streamline the process because any contractor that receives an invitation for bid has already gone through this vetting process. So you're removing a lot of work that you might have to do down the road to make sure that you're hiring the right people.
It could, just to clarify, right now.
Not right.
Yes,
not
but in the future,
not in this case,
right.
but in the future, it
Right.
could
If you wanted to do it for a
streamline
year
the
long.
timeline for some of these projects. Yeah.
Yeah.
So, okay. Is there any public comment? Okay, I don't see any public comment on this item. I'll look for a motion.
I'll move on staff recommendation.
I'll second.
Motion by Supervisor Rotifer, second by Supervisor Kirk. Would you please read the roll call, clerk of the board?
Supervisor Brennan?
Aye.
Supervisor Campbell?
Aye.
Supervisor Kirk?
Aye.
Supervisor Gray?
Aye.
Supervisor Rotifer?
Aye.
Okay, motion passes 5-0.
Thank you.
Thank you very much. So we had tabled the discussion of Fire Prevention Week was, okay, so we'll keep that one tabled for now.
I did send, is he going to do it? Okay, he's ready.
Okay, so we wrangled somebody up. So would you please reread item 11?
Item number 11, consideration of adopting Resolution 9420 proclaiming October 4 through 10, 2020 as Fire Prevention Week in Tuolumne County.
All right, Mike.
Yeah, good morning. So Mike Blanken, I'm Deputy Chief for the Tuolumne Calaveras Unit, and I'll be speaking on behalf of Andy Murphy this morning. So my apologies for the confusion there before. I think we had our wires crossed on whose responsibility is what this morning. So my ask this morning is going to be for the board to adopt October 4th through 10th as Fire Prevention Week in Tuolumne County, and I'll summarize the resolution real quick for you guys. So the County of Tuolumne is committed to ensuring the safety and the security of all those living in and visiting the county. And fire is a serious public safety concern both locally and nationally, and homes are locations where people are at the greatest risk from fire. Home fires killed 2,980 people in the United States in 2019, representing the majority of all fire deaths in the U.S. They also caused 13,900 civilian injuries and resulting in over $12 million in property loss. And cooking is the leading cause of home fires in the United States, where fire departments responded to more than 172,900 fires each year between 2014 and 2018. The theme for the 2020 Fire Prevention Week is going to be Serve Up Fire Safety in the Kitchen, and effectively serves to remind us to stay alert and use caution when cooking to reduce the risk of kitchen fires. So again, I would ask the board here to proclaim October 4th through 10th, 2020 as Fire Prevention Week throughout this county, and urge all people in Tuolumne County to do so by checking their kitchens for fire hazards and using safe cooking practices during Fire Prevention Week 2020, and to support the many public safety activities and efforts of Tuolumne County's fire and emergency services. Thank you.
Thank you, Mike. Any comments from the board?
I'll just say that I'm all for declaring October 4th through 10th as Fire Prevention Week in Tuolumne County, but every week, every day, all year long ought to be Fire Prevention week and day in everybody's minds. We live in a particularly flammable environment up here, and we need everybody, every member of the public, every visitor, which a lot of people that come here are not really as cognizant of some of the dangers that we have here. But every visitor, everybody that ever steps foot in Tuolumne County needs to be extra safe all the time. But certainly October 4th through 10th, we ought to focus on that as well.
That was going to be my comment. Every day, every week, every minute, fire prevention. That's what we have to think about. So thank you.
Thank you all.
Any comments from Supervisor Brennan?
Yeah, I just agree with what's already been said. Every day, every week, we need to be focused on this. And if you haven't seen the Bear Fire letter from Dave Daly, who was in the fire up in Plumas County and did a 5-day diary sharing his experiences, they're very, very reminiscent of what a number of folks experienced in the rim fire. Please Google it, read it. It's a good read. It's important, but we need to do so much more around this issue. Thank you.
Yeah, and I couldn't agree more. Some of the things, I just look at my own property. I took a large amount of the land surrounding my house. I took it down to bare dirt, just because it's just too much risk. You have portions of, I'm just speaking about my property that align the road, a huge fire risk, and you need to really be cognizant of that. And then one of the things that Mike highlighted was related to in-home fires, and we can't forget that even though we live in a wildfire fire region of the state, that home fires occur as well, and we need to make sure that we have our smoke detectors and all of that in-home fire safety equipment that's required by law to help prevent those larger community fires starting. So with that, I'll look to see if there's any public comment. Okay, I don't see any public comment. Is there a motion?
I'll move to adopt Resolution 95-20 proclaiming October 4th through 10th, 2020 as Fire Prevention Week in Tuolumne County, with the proviso that we ought to all be practicing fire safety every day. Thank you.
Second.
You have a motion by Supervisor Rotifer, second by Supervisor Gray. Will you please read the roll call?
Supervisor Brennan?
Aye.
Supervisor Campbell?
Aye.
Supervisor Kirk?
Aye.
Supervisor Gray?
Aye.
Supervisor Rotifer?
Aye.
Okay, motion passes 5-0. All right, so we will be moving into closed session, after which time we will adjourn into recess until 1:30. Clerk, will you please read the closed session items?
Item number 16, closed session, conference with legal counsel, initiation of litigation, authority, government code section 54956.9, D4, one case. Item number 17, closed session, conference with legal counsel, existing litigation, authority, government code section 54956.9, D1, Diana Rios versus County of Tuolumne et al., Stanislaus County Superior Court case number CV 20-001942. Item number 18, closed session with Conference of Labor Negotiators, Tracy Riggs, County Administrator, Eric Earhart, Assistant County Administrator, Ann Fremd, Human Resources Director / Risk Manager, Debbie Batista, Auditor Controller, Authority Government Code Section 54957.6 for the Tuolumne County Deputy Sheriff's Association, the County of Tuolumne Management Association, and the United Domestic Workers of America, Number 19, closed session conference with legal counsel, existing litigation, authority, Government Code Section 54956.9D1, National Prescription Opiate Litigation, United States District Court for the Northern District of Ohio, Eastern Division, case number 117-MD-2804-DAP.
Okay, is there any public comment on any of these closed session items? All right, so we will go into closed session, and after which time we will recess for lunch, reconvening at 1:30. Okay, we're going to reconvene the meeting of the Tuolumne County Board of Supervisors. We have nothing to report from our closed session items. Clerk, would you mind reading the instructions for the public comment process and then we'll move on to our 1:30 p.m. appointment?
If the public would like to comment on any of the items being heard this afternoon, they can call 209-533-6581, and their comment will be heard in the order it was received once the chair has called for public comment. (1:30 p.m.) Item 1, public hearing to consider Woodward ordinance for zone change RZ 20-005 to rezone a 2.28 acre APN 038-240-008 parcel from R1 single family residential to RE-1 residential estate, 1 acre minimum under Title 17 of the Tuolumne County Ordinance Code.
Okay. Afternoon, Quincy.
Good afternoon, Quincy Yaley, Community Development Department Director. Before we get started with this item, I just wanted to take a moment to introduce a staff member to you. This is Shady Gonzalez. She is a land use technician in the Land Use and Natural Resources Division. She's been with us about a year, but this is the first time she's had a project that's made it through to your board. So just wanted to take an opportunity to welcome her.
Wonderful. Welcome.
Good afternoon and welcome. Again, my name is Shady Gonzalez, Land Use Technician from the Community Development Department. Today, I will be presenting zone change RZ 20-005 for the Woodwards. The Land Use Division supports creativity in responding to the future needs of the community through the application of the vision, mission, and value statements adopted by Tuolumne County. We encourage innovative and creative approaches to problem solving. The project is an ordinance for a zone change to rezone a 0.28 acre parcel from R1 to RE1. The proposed zone change is being requested to facilitate a re-subdivision to adjust property boundaries between 3 legal parcels. In order to facilitate this request, assessor's parcel number 038-240-008 must be rezoned for consistency with the general plan. The re-subdivision is not being considered at this time and will be handled by the county surveyor at a later date. The project also includes the approval of a notice of exemption. The project is located at 20418 Green Acres Road in the community of Sonora. The general plan land use designation is low density residential. This map shows the parcels involved in the re-subdivision, all of which have a general plan land use designation of low density residential. The exhibit map shows the property lines proposed to be adjusted with a re-subdivision at a later date. The summary table shows the parcel for the proposed zone change highlighted in yellow. You can see that the acreage is increasing to meet the minimum acreage for the RE1 zoning from 0.28 acres to 1 acre. The chart also shows the current development and the potential maximum density per parcel. And on May 12th, 28 adjoining property owners were notified of the project. No comments were received. Here are the required findings of the rezone application. Evidence and staff's response to each point can be found within the agenda report. On September 2nd, the Planning Commission reviewed and recommended approval of rezone 20-005. Your board may either approve the project with modifications, deny the project, send the project back to staff for further review. Should the board choose to approve the project, provided before you is the language. Do you have any questions?
Any questions from the board? Okay. Any public comment on this? All right. So I'm going to open the public hearing on this item. Looking for board questions. I don't see any. And then I'll look for public questions. Okay, seeing none, I will close the public hearing and bring it back to the board. This is in my district, but I'm open to.
In that case, I'll move on. Let me see how I do this. Yeah, I'll move to approve the zone change RZ 20-005 to rezone it from R1 to RE1.
I'll second that.
Okay, so I have a motion from Supervisor Rotifer and a second from.
Cite the findings A through D.
Oh, based on findings A through E, B, D.
And then 2.
A through D, 1A through 1D, and 2.
Okay, looking for the thumbs up from staff. Is that sufficient?
Supervisor, you're also moving to direct the environmental coordinator to approve the notice of exemption.
Okay, included in my motion is to direct the environmental coordinator who's sitting there to approve the notice of exemption.
Second.
Okay, we got a motion from Supervisor Rotifer.
I know how to do this.
Second from Supervisor Gray. And then could we do the roll call vote?
Supervisor Brennan? Supervisor Brennan, your vote?
Aye. I'm sorry, I'm having a hard time hearing you all.
No problem, thank you. Supervisor Campbell?
Aye.
Supervisor Kirk?
Aye.
Supervisor Gray?
Aye.
Supervisor Rotifer?
Okay, motion passes 5-0. Okay, so clerk, would you please read the second 1:30 appointment?
1:30 p.m. to public hearing to consider Mills Act contract MIS 19-024 to enter into a historic property preservation agreement to preserve the two-story brick Queen Anne building known as the Emporium, adopting Resolution 96-20 to add the Emporium structure on the property to the Tuolumne County Register of Cultural Resources.
Mr. Vice Chair, I want to recuse myself from this matter in an abundance of caution. I do have some relationship within the ownership of that property. Thank you.
Okay.
All righty.
Good afternoon again.
Good afternoon. I'm Shady Gonzalez, Land Use Technician from the Community Development Department. Before the board today is Mills Act Contract MIS 19-024. Here are the vision, mission, and value statements adopted by Tuolumne County. The project is a Mills Act contract to enter into a historic property preservation agreement to preserve the Emporium and a resolution to add the structure to the Tuolumne County Register of Cultural Resources. The project is located at 18880 Main Street in Jamestown, assessor's parcel number 003-171-012. The general plan land use designation is general commercial, and the zoning is general commercial, design review, historic design preservation, and mobile home exclusion under Title 17. Here is a map of the location. Only the Emporium structure is being proposed to be entered into the contract. The Mills Act requires a formal agreement executed between the property owner and the county for a minimum 10-year period. The property under contract is reassessed using a different tax formula than is used for a non-historic property. It may result in a significant annual property tax savings. In 1972, California legislature adopted the Mills Act. 20 years later, Tuolumne County then adopted what is now Resolution 171-92, which encompasses the structure of a Mills Act contract. On July 6, the Historic Preservation Review Commission recommended approval of the project. Notices were sent prior to the board hearing and no comments were received. Your board may either approve the project with modifications, deny the project, or send the project back for staff for further review. Staff recommends approval of the proposed Mills Act contract based on findings 1A through 1D. Staff recommends approval of the resolution to list the Emporium on the Tuolumne County Register of Cultural Resources based on the findings 2A through 2D. Should the board choose to approve this project, provided before you is the language. Are there any questions?
I'll open the public hearing. Are there any questions from the board? Okay. I'll look to the back and see if there's any public comments on this. All right, seeing no public comment, I'll close the public hearing. I guess I can make the motion. I dropped the ball on the last one.
Okay.
So I move that we approve the proposed Mills Act Historic Property Preservation Agreement based on findings A through D, and further approve the resolution to list the Emporium on the Tuolumne County Register of Cultural Resources based upon the findings A through D. And that.
I second.
And that's all you need. Okay.
I second the motion.
Okay. Motion by Supervisor Campbell, second by Supervisor Rutherford. Clerk, would you please call the roll?
Supervisor Brennan?
Aye.
Supervisor Campbell?
Aye.
Supervisor Kirk?
Aye.
Supervisor Rutherford?
Motion passes 4-0 with one recusal. All right, so we'll move on to our third 1:30 appointment. Clerk, would you please read that agenda item?
1:30 p.m., number 3, presentation by the Code Compliance Division on Cannabis Enforcement in unincorporated Tuolumne County.
Hello again.
Hello again. Quincy Yaley, Community Development Department Director. I just wanted to take a few minutes of your time this afternoon to give a very brief presentation on the status of our cannabis enforcement activities. This happens through our Code Compliance Division within the Community Development Department. I want to be really clear, this is only related to those areas in unincorporated Tuolumne County, not including anything within the city limits. So just a little bit about our division and who it is. It's actually really 1.5 people who are doing all of the code compliance planning and building work related to those divisions in the county. So we have one investigator. We have an administrative assistant who spends about half her time supporting those efforts. And then the code compliance program right now is overseen by myself, the department head. Just a little bit of a breakdown I wanted to give to you for over the last few years. In 2018 is when the county adopted the cannabis regulations. So you can see that from 2017, what our total caseload is related to zoning violations and building violations. This does not include grading violations, solid waste violations, or environmental health violations. So this is just really what our division is tasked with overseeing. And so in addition to that total line, you can see the line below of the number of cannabis complaints that we receive annually. So it actually has held semi-steady since the ordinance was put into effect.
Quincy, can I ask you a question about those statistics? Are those actual investigations, or are they requests for action?
Those are investigations. So,
Okay.
and by investigation, I mean we receive a complaint,
Yes.
and the investigator goes out to take photos and see what the situation is on the ground.
I think those numbers then are a little misleading, and that's why I asked the question. Because I know just in my district, I have a whole lot of complaints that have not, I don't believe, have been investigated yet or followed up on yet. There's a backlog.
Well, this is the total number of complaints our department has received.
Okay,
So
that's what I was asking.
If there's other complaints out there above 24, 22, 25, 21, they have not contacted us to take action.
No, I'm not talking about cannabis. I'm talking about the planning and the building
Okay.
compliance.
Sorry, you were looking at the above number. Yes, these are the total number of complaints that we receive with respect to those two different violations.
Okay.
Areas. Okay. So our cannabis investigation program, is limited in some ways by staff resources, but our investigator, this is not a one and done. We don't get a call and necessarily have the ability to take action that year. This is a multi-year long process where we're working with our local, state, and federal partners to track these cases and track information. And then what we've done in the recent years is rather than acting alone just as Tuolumne County, we've teamed up with the California Department of Fish and Wildlife, Bureau of Land Management, and the U.S. Forest Service. And so these are really a multi-agency effort and a multi-agency approach to cannabis enforcement in the county. We also receive support from the Sheriff's Department in a number of ways, just really whatever we need. Whenever we call, they're able to give it to us. So while they're working with us and our state and federal partners are working with us. To date, just this year, we've eradicated over 12,000 cannabis plants in unincorporated Tuolumne County. And when I say we, that is the task force team that is working together on these situations. This is a picture from an activity that happened a while back, but I just put it up there so you could see the number of vehicles from the state agencies and the federal agencies that come out to these enforcement activities. In this picture, there's well over 20 state and federal vehicles that are out there helping Tuolumne County deal with illegal cannabis cultivation in the county. So just as a reminder, these are the cultivation limits that the Board of Supervisors adopted. It does vary depending on the zoning district. Also, there are a lot of other particulars of how a cultivation activity is required to take place in terms of additional setbacks, looking at sensitive receptors adjacent to project sites or within a project site vicinity. And then there's also a lot of technical details that go into the actual operation, the electrical, the power situations, air conditioning, ventilation, water filtration, et cetera. So it's a very detailed ordinance code, but this is just some of the basics of the plant limits that are allowed. When we visit a cannabis site that exceeds the plant counts that are allowed in our ordinance, it's very typical for us to observe other violations. I'm going to show you some pictures of that here at the end. We oftentimes see illegal grading on a project site that leads to impacting drainages. That's a lot of the ways that we're able to gain traction with our state and federal partners is from the impacts to waterways and other drainages. We also see a lot of illegal wells and other water supply setups that have occurred. We see building and safety violations related to structures and electrical. We see solid waste violations, accumulation of debris and other materials. Oftentimes, there are very unsanitary conditions with respect to environmental health and hygiene, as well as illegal chemicals on these grow sites. And lastly, even I have observed just disturbance to other cultural resources that are in the vicinity or on grow sites, as well as other sensitive environmental habitats. So these are just some pictures from actual violations that we've observed. This first one here, you can see that they're using a very large industrial generator. They've installed some electrical panel boxes here, cords running everywhere. A concern that's very clear is danger for fires to occur from the electrical situations on these sites. Another picture showing an accumulation of empty fuel cans or semi-empty fuel cans, as well as other debris. This is a picture of a restroom that had been constructed. The middle picture is sort of the back side of it. You can see that there's been electrical connected to the building, and then it's carried through a series of extension cords and surge protectors around the side of the building. We have a lot of empty containers that are unmarked, so we have a lot of fluids and materials that we don't know what they are, as well as, again, just additional structures and electrical work done. Solid waste is very common, and sometimes it's in a nice, neat pile like this because they're using the remainder of the property for cultivation. This is an illegal well on a project site. You can see the cement is broken around the well seal. So that leads to concerns about groundwater contamination from chemicals that are being used on a grow site. So I just wanted to share a couple of pictures with you guys briefly today, just to make sure that you and the public are aware that our efforts to enforce illegal cannabis cultivation are still ongoing. We are always working to expand our program. We're looking to do some additional staff training with relation to on-site safety, as well as hazmat. And we, of course, are grateful for and want to continue our partnerships with our other agencies and divisions here at the county and our state and federal partners, because that's really how we're able to leverage resources into an enforcement action. So just a really brief presentation today. I'm happy to answer any questions that you have, but just wanted to give you a brief update.
Just a quick one. Do we have any area that has more growing than, is it national forest? Is it ag land? Where are most of the stuff that you're finding being grown?
It's countywide. We're of course not enforcing on areas that are either state or federal properties, but our investigator is in frequent communication with those officials, and they're finding it on those properties as well. So I really can only speak to the private property in Tuolumne County, and we see it on both highway corridors and down in western Tuolumne County too.
So just to clarify, if somebody calls in and they actually go out and they do an eradication or they go do code compliance, that's where that number's showing up, the 25, 24? Or is there other lists of
So this is the number of complaints that we've gotten. And they have varying levels of closure, I guess I would say.
This is just off the top of my head, I'm curious, like, you got Calaveras County who allows cultivation. Do you have any idea what those numbers might be for them? Have you seen anything or?
I don't know.
Yeah, okay. And my last question would be, obviously a lot of environmental damage. Are there any environmental groups part of this team who are going out for these eradications, or is it all what?
Yeah, so these are public agencies that are working together right now. When we are on site, there are also representatives from the Water Board, and there are Fish and Wildlife environmental scientists who are doing field surveys and documenting those impacts. But they are public employees.
No private, no like CSIRC or anything concerned about it. Okay.
Not participating in these activities.
Okay. All right. Thank you.
Okay, any other questions from the board? Okay, I'll open it up to public comment. Okay, I don't see any public comment there. Oh, Sherry, did you have a comment?
Question though. Quincy, are there any funds from the state to help with these eradications?
Heather, what was that question? What was the question?
Could
Oh, yes, thanks, Sherry. So I think the question was, do we have plans from the state to eradicate for this eradication efforts? Okay, so Sherry, what you can't see in the photo here, or maybe if you're looking online, is we're working closely with the state, at least the wildlife enforcement agencies, on the eradication efforts. Representatives from, the cannabis licensing divisions and departments of the state, those are not entities that we are working with at this time. But that's not to say that there couldn't be partnerships formed there in the future. Right now, we're strictly working with enforcement agencies that I do believe are receiving funding, state funding, from those, those cannabis fees and fines.
Okay. All right. Well, seeing no more questions, thank you very much. Okay, we'll move on. I think we've gotten through everything. Move on to reports. We'll start with CAO Riggs. Okay. Anything to report from County Council? Okay, Clerk, anything to report? Just another happy day. All right. Supervisor Gray.
Nothing to report.
Supervisor Rotifer.
I'll make it really simple. Nothing to report.
Okay. Supervisor Kirk.
I'm sure I have stuff to report, but I'll keep it simple like everybody else. And I do have something to report. I'm getting Mount Provo Road fixed. We started Tuolumne Safe. It's a nonprofit. I know we do great things and lots of grants and forest thinning projects and road clearing, but Provo Road's in my district, and I didn't see any light at the end of the tunnel, so we formed a nonprofit, and we're going to be getting rock out there next week. And so the folks in Ponderosa Hills, you'll have an evac route should you have a fire. So other than that, that's it.
Okay. Well, I've been oh, yeah, that's right. Supervisor Brennan.
No report.
Okay. All right, I'll bring it home. I really want to thank Kelly Brown, our homelessness task force coordinator, for the work that she's been doing. Been working with her on our task force, and we're moving along, getting the key stakeholders involved on that. So there's some progress there. I also wanted to do a plug as well for there's a new program on community access cable that is produced out of the Tuolumne County Library called Read Aloud. and our very own Lynn McCormick is hosting that. And so we've had a great deal of cooperation with the Friends of the Tuolumne County Library, and we have our very own local Mr. Rogers type show now. So very happy to see that, and I urge everybody to check that out. And with that, thank you very much, members of the board, staff, and members of the public. I'll adjourn the meeting for today. Thank you.